Think you know how to give paracetamol safely? Most people get it wrong, and the consequences can be serious. From giving too much too often, to guessing doses by age or using household spoons, small mistakes can quickly become dangerous. In this quick clinical guide, we'll break down the most common dosing errors of paracetamol and show you exactly how to avoid them, whether for children, adults, or high-risk patients. By the end of this video, you'll know the safe way to use paracetamol every time. Let's get started. Despite being widely regarded as safe, paracetamol is surprisingly prone to dosing errors. Here I take a closer look at the key reasons why paracetamol dosing mistakes are so common. Let's start by looking at how multiple formulations and strengths of paracetamol contributes to these errors. Paracetamol comes as 500 mg tablets, 325 mg combination tablets, liquid suspensions of 160 mg per 5 ml or 250 mg per 5 ml. A patient may accidentally take two different strengths, leading to under- or overdosing. Next reason is that paracetamol has many combination products. Many cold or flu medications contain paracetamol. For example, a patient taking both a multi-symptom cold syrup and regular tablets may unknowingly exceed the recommended daily dose, leading to overdosing. One of the most common and dangerous reasons for paracetamol dosing errors is confusion around the maximum daily dose. Important safety reminder. When calculating the maximum daily dose of paracetamol, all sources must be considered. This includes prescription products, over-the-counter formulations, and combination medicines. Missing even one source can easily push a patient into toxic dosing. Paracetamol is only safe when the maximum daily dose is clearly understood and correctly applied. Pediatric maximum daily dose. In children, dosing errors are especially risky due to weight-based calculations. To reduce the risk of hepatotoxicity, the daily dose should be limited to less than or equal to 75 mg per kilogram per day. A maximum of 5 doses per day should be given. And the absolute daily maximum must not exceed 4,000 mg. Failure to follow these limits significantly increases the risk of liver injury. Next is to understand adult maximum daily dose. In adults, the commonly cited maximum daily dose is 4 grams per day. Life-threatening hepatotoxicity has been associated with doses greater than 4 grams per day. Although doses less than or equal to 4 grams per day are generally tolerated, rare cases of hepatotoxicity have been reported even below this limit. Because of this risk, some experts recommend a lower maximum of 3 grams per day in adults with normal liver function, especially when paracetamol is used for more than 7 days. High-risk patients requiring further dose reduction or avoidance. There are certain patients who are at high risk of toxicity and may require additional dose reduction or complete avoidance of paracetamol. These high-risk groups include patients with heavy alcohol use, malnutrition or prolonged fasting, low body weight or advanced age, liver diseases, and concomitant use of interacting medications. The timing of doses is another area where errors commonly occur. One of the most common paracetamol dosing errors is taking doses too frequent. Many people give or take paracetamol every 2 to 3 hours instead of the recommended 4 to 6 hours. This type of paracetamol especially occurs during high fever or severe pain. Dosing too frequent can cause paracetamol to build up in the body, leading to overdose, and increasing the risk of serious liver damage, even when each individual dose looks safe. Dosing errors become even more concerning when paracetamol is used in children. The most common paracetamol dosing errors in children happen when doses are not calculated using the child's weight, milligram per kilogram body weight. Many caregivers estimate the child's dose based on age alone, use an outdated weight, or adjust an adult dose by eye. These mistakes can easily lead to underdosing, which fails to control pain or fever in children, or overdosing, which increases the risk of paracetamol toxicity and liver injury. You can use the pediatric maximum daily dose section to determine an accurate total daily dose. If you need help with dose calculations, leave a comment and I'll explain a simple, accurate approach. Even when caregivers try to calculate the correct dose, unit confusion creates another major risk. Milligrams and milliliters are not the same, mixing them up can be dangerous for children. Caregivers may correctly know the dose in milligrams but accidentally give the same number in milliliters, which can be dangerous. The last reason why paracetamol dosing errors are so common is that using household spoons, which is a common cause of inaccurate dosing in children. These spoons vary widely in volume, leading to inconsistent and unreliable doses which can result in giving too little or too much medication. Best method is to give a medication with a proper oral syringe or dosing cup. Most of these errors are avoidable with correct dose calculation, awareness of combination products, and strict attention to dosing limits and intervals. Safer paracetamol use starts with education, clear communication, and vigilance from both patients and healthcare professionals.